Hey everyone, it's Chad again, and I am back with you with HIV 101 Part 6, which has to deal with what happens when you receive a positive diagnosis for HIV from the doctor or after you've been tested. So the first thing I think to tell yourself if you receive a positive diagnosis is that it's not the end of the world. And if you're feeling powerless or helpless, I think the important thing to remember is that you were powerless by not knowing, but by knowing now, you have all the agency, all the power, and all the information available to you to get the help you need, to get the care you need, to take control of something that is negatively affecting your health, negatively affecting your body. So that's what this presentation is going to cover. Treatment options for people living with HIV. So once you have taken time to process the news, of course you may feel several things, emotions from sadness, hopelessness, or anger. But again, you just have to tell yourself that this is not the end. There are healthcare providers and social service providers, such as myself, who can help you work through these early stages of diagnosis. Most time they are available at your healthcare provider's office. If you already have a provider, they may have the knowledge to treat your HIV. If not, they can refer you to an HIV healthcare provider. Plus, you can also find Ryan White program providers who can help you access care, medications, and essential support services you need. You can do so by visiting findhivcare.hrsa.gov. So that again, that's findhivcare.hrsa.gov. And this will be at the end of the video on the blue screens. So treatment post-diagnosis is known as ART, which is antiretroviral therapy. And this reduces the amount of HIV in the blood, also called viral load. And so eventually the viral load will go into viral suppression after treatment. This is a viral load which is basically below 200. At this point, the virus can no longer be transmitted to another sexual partner. So consistent ART can make a viral load so low that it becomes undetectable. So this is a viral level of under 20. So getting and keeping an undetectable viral load or staying virally suppressed is the best thing you can do to stay healthy living with HIV. Most people can get the virus under control within 6 months of consistent ART. As your viral load goes down, your CD4 count will rise, restoring your immune system function. It is important to be consistent in taking HIV meds every day. If you skip your medications every now and then, you're giving the virus basically a chance to multiply again. And then also, what happens when you skip your medications is that it can make the virus more resistant to the medications that you are taking. So it's important to be very diligent in taking your medication every day. And the reason why is because the virus basically, it mutates. It can change and mutate just like viruses do. We've seen this with the flu, COVID, the common cold. They have different variations. So the important thing is not giving your body or not giving the virus that's in you the chance to change and resist. So developing drug resistance limits your options for successful treatment. So having an undetectable viral load helps prevent transmission from a mother to her baby. So if a mother with HIV takes her meds as prescribed throughout pregnancy, labor, and delivery and gives HIV medicine to her baby for 4 to 6 weeks after birth, the risk of transmitting to her baby is less than 1%. So talk to your doctor if you're having trouble sticking to your treatment plan or you're developing side effects. Some common side effects include nausea and vomiting, diarrhea, difficulty sleeping, dry mouth, headaches, rash, dizziness, fatigue, and pain. And then it's important to talk to your doctor, because if a medication is causing these things and they're becoming unbearable, there are other medications. There's quite a few medications to suppress HIV. So yes, it's very important to talk to your doctor. And again, knowing your status gives you the power of knowing, and you have control over the virus. In New Orleans, there are several service providers that can link you to care and get you to the resources you need to maintain or improve your quality of life. And we at Frontline, we're one of those agencies, and I, as a case manager, I'm that person that you would talk to, get referred or get the proper resources that you need to just have a high quality of life. So that basically concludes HIV 101. Thank you for following this through its entirety and whatnot, and stay tuned because we have a lot more information to share with you. So thank you and have a good day.